Shadow Minister.
Thank you, Chair, and it's a pleasure to serve under your stewardship today, and touching as myself as a GP who has seen patients with valve injuries and mesh injuries, to suddenly be stood at the dispatch box as a chance to be able to raise this up is humbling in my side personally for me. But I'm extremely grateful to the Honourable Member for Washington and Gateshead South for proposing this debate. It's yet another important topic that she's brought to this House, and she's actually in danger of rivalling the member for Strangford for bringing so many Westminster Hall debates on health, and a true testament to the dynamics we have here of two worthy champions fighting it out for the person in the country doing the most for health, and congratulations to her on that. And I also remember her powerful contributions to last month's Westminster Hall debate on women's health last month. And again today, she's done the same. With her personal experience of her mother's situation, and as the chair of the APPG for First Do No Harm, she really is a true champion. Now that we're past the first anniversary of the Hughes report, this debate is an important opportunity for those women and families affected by valproate and pelvic mesh to get clarity from the government on what progress is being made on the recommendations of the report and a way forward broadly. And it's heartening to see here today, unanimously, how the Chamber has come together to ask for that progress. I welcome that the previous government took productive steps and asked the Patient Safety Commissioner, Dr. Henrietta Hughes, to undertake work in this area. And Dr. Hughes' report was issued a year ago now, and it's clear that the victims are anxious for some form of redress for the harms that have been caused. The report states, and I quote, "The first point to make clear is that the Commissioner thinks there is a clear case for redress based on the systemic health and regulatory failures revealed by First Do No Harm review in 2020. The Commissioner supports a restorative practice-based redress scheme, co-design and with affected patients, and which is therefore, by very definition, different from proceedings which court proceedings which seek to attribute blame. Of course, the punctuation of an election halts progress, and now, with new ministers and a new government 9 months in, it's right to continue keeping the spotlight on this topic. So to that end, my questions today echo many of those raised in the room here. Could the Minister clarify the government's position on her recommendation for financial redress and when they will respond to the report? Could she give a time frame? And has the government or the ministers met with Dr. Hughes and campaigners to discuss the report? And will she commit to communicating with all those affected, as we've heard, as it's so important to help reduce some of the anxiety? It's already been a long and painful journey for victims, so continuing to take steps forward to address the fallout is really important. Further to the Hughes report, I'm also glad the last government took several actions beginning addressing the injustices suffered by victims of valproate and pelvic mesh. My honourable friend for Godalming and Ash, the former Health Secretary, established the Cumberledge Review, and significant progress was rightly made before the election on implementing 7 of Dr. Hughes' recommendations, including an unreserved apology to the women affected, children and their families on behalf of the healthcare system, for the time the system took to listen and respond. And I'm pleased to see that the Honourable Member for Gorton and Denton, the new Minister at the time, reiterated that apology when these issues were last debated in December 2024. The appointment of Dr. Hughes as the first Patient Safety Commissioner to advocate for patients and improve the safety of medicines and medical devices, and a network of specialist centres established to provide comprehensive treatment, care and advice for those affected by implanted mesh. Now, honourable members have already referenced the Westminster Hall debate on these issues last December, and looking at that debate, I was pleased to hear from the Honourable Member for Gorton and Denton that the government was committed to implementing the remaining 3 recommendations and that this was a priority for the government. He said, "It's a priority for this government. We are working at pace and we remain focused on making meaningful progress. This is a complex area of work involving several departments, but we are committed to providing an update at the earliest opportunity. I have heard the desire for urgency today, and I hope that we can make progress that members want to see." Now, I know that there's been a change in personnel in the ministerial team since that debate, but can the Minister confirm this remains a priority for the government regardless? And given it's 4 months since the last debate, and the Minister recognises the desire for urgency, what new update can the Minister provide on that progress that has been made in implementing these recommendations since December? Now, as stated, I was in the debate on the women's health last month, in which the Honourable Member for Washington and Gateshead South raised the issue, and the Minister's response was, I quote, "On sodium valproate and pelvic mesh, the Cumberledge Review made 9 recommendations, of which the government accepts 7. I can confirm that the national pause remains in place. I also note that the Minister frequently quotes the following lines in her response to written parliamentary questions from colleagues. The government will be providing an update to the Patient Safety Commissioner's report at the earliest opportunity." So could she say today, is this the earliest opportunity today? If not, would she be kind enough to give an estimate of when this might be? During that December debate, my shadow ministerial colleague, the Honourable Member for Sleaford and North Hykeham, also raised concerns about the experiences of some of the women within the specialist mesh centres and urged ministers to look into this. I'd be grateful if the Minister could set out, does she share those same concerns? If so, what steps have her department take to address these and look into them? And finally, regarding sodium valproate, we've heard from the member for Harrow East and the member for Bexley Heath the difficulty we have when it comes to valproate about the damage it can cause, but how important it is as an epilepsy drug to support those keep seizure free. The report itself states, however, the Commissioner continues to have concerns about incomplete adherence to the pregnancy prevention programme requirements. As a result, in November 2023, she recommended that NHS England created a fully funded and resourced system for improving the safe use of the most potent tractogenic medications, beginning with the safe use of valproate. So that being said, could the Minister update this House on the work stream regarding tractogenic medications, and more importantly, given the news of the abolition of NHS England, what safeguards are being put in place to ensure this system is resourced adequately? Chair, 1 year on is a milestone, one to be celebrated for getting this far after such a torrid journey in raising concerns, having them heard and getting them responded to. But it is just that, a milestone in a journey, not a destination. And for those so affected and their families, they will be keen to know what redress they are due, the mechanisms to deliver it, so their cases might finally be fully rectified. After all, we cannot undo the past, but we can make amends for it, and I hope the government will continue to act on the recommendations to do so.